what is this comprehensive unit-based safety program, and how can it help to achieve this? Well, really what this program is about is to improve the context in which care is delivered. It's supposed to improve the way we take care of our patients, the way we take care of ourselves, and the way we take care of each other. Essentially, we're trying to improve the environment in which the work is delivered so that the work can be done as reliably as possible. So why is it so hard to reduce bloodstream infections? Doesn't that drive you crazy? It's like all we need to do is wash our hands, keep the line sterile, and get it out as soon as possible. It should be easy, right? It should be an easy thing to do. Why can't we accomplish it? Well, Dr. Sexton will talk about this in much more detail, but there's a large science, the science of safety, that really shows that for us workers in complex work environments, we are predestined to make mistakes. We're predestined to forget things. We're predestined to screw up. And the reason why we do that is because we have a lot of things on our minds. Nurses have to do hundreds of things during the day, hundreds of tasks to complete. Doctors, similarly, there are a lot of decisions we have to make every day. Sometimes you just forget. And so really what the science of safety says is we shouldn't focus on people, because all of us are well-intentioned to do the right thing for babies. But we should create a system that allows us to prevent errors from ever reaching the patient, or errors from creating the harm that they can do if they reach the patient. So in developing a culture to identify what's broken and fix it, we will be able to support all the interventions that Yvette has been talking about. So what is this thing, safety culture, that we're trying to improve? Well, I think clinicians kind of best understand it sort of as the way we do things around here. And really, safety culture is central to the CUSP project. It can be measured using the survey, the Safety Attitudes Questionnaire that you just completed. And really, this questionnaire has been shown to be reliable, responsive to interventions, and associated with clinical and operational outcomes. And if you see the list of outcomes here, you know, is it just surprising that not more efforts are being done to really improve the culture of safety? Well, actually, a lot of efforts are now going on because ever since the CUSP project was published by Peter Pronovost and Brian Sexton in the New England Journal in 2006, and they showed a 66% reduction in infection rates, bloodstream infection rates across Michigan ICUs. This intervention has become a priority of the US government and many states for implementation in all hospitals. So I put the checklist picture on here because many of you may know the CUSP project as the checklist project. And however, the checklist really is only one part of this entire intervention. It is a part that allows us to kind of drive culture change, because in the original intervention, it allowed nurses to tell doctors who were putting in lines to say, like, well, look, doctor, you know, please, you didn't wash your hands. Could you please, you know, go back, wash your hands before you put in the central line? And even though the doctors thought, like, you know, oh, we're doing these 5 little things on this checklist, we're doing those all the time, it actually turned out that they weren't doing them all the time. That about 30% of the time they weren't doing even the simple steps. So by making things reliable and changing the culture, making it okay to speak up and to stop the line when there was an imminent error, you know, that really was drove the improvements in outcomes. Now, what evidence do we have to suggest that CUSP will be effective and that changing safety culture will be effective in helping us reduce bloodstream infections? Well, here's a slide from this initial project. Each bar on this slide represents an intensive care unit, adult intensive care unit in Michigan. And you can see the teamwork climate ratings as deducted from the safety attitudes questionnaire. There are many other domains that we're measuring, but this is just one domain. It's called teamwork climate, the way that people work together. And it's listed here, and you can see it ranges from just above 10 to over 90% of respondents in an ICU saying that teamwork climate is good. Now, when we overlay bloodstream infections, you can see that like the top third ICUs in terms of teamwork climate were able to have no bloodstream infections for 5 months or more. 44% of ICUs in that top third were able to achieve no infections for 5 months, versus in the lowest third, only about 21% of ICUs were able to achieve that. And the strongest predictor for clinical excellence was really one of the items in this teamwork scale, and you just filled it out, was whether caregivers feel comfortable speaking up if they perceive a problem with patient care. So if you can't speak up, you can't stop the line, errors will happen. Now, this is all adult work. Like, does this apply to the NICU? Well, actually, Dr. Sexton and I, we just completed, with the help of a Texas Children's Hospital pilot grant, we completed this work in California, where we surveyed 44 NICUs in California regarding to safety culture. And I'm just showing you one slide here, and you can see each NICU, again, is one of these bars, and you see a lot of variation in teamwork culture, from somewhere in the 30s to almost 100%. Now, really, you want to be above 80. That's your goal. If 80% of respondents in your NICU say that teamwork is good, that's a good place to be. If you're below 60, that is where the literature has shown that a lot of problems occur. Now, about a third of these NICUs are below the rate of 60, and typically, if you are below a rate of 60, you can see the number of, or the kind of problems that occur in these ICUs. Caregivers tend to be burned out. Burnout is just a few steps away from major depression. There tends to be disruptive behavior. People are fatigued. There's high turnover rates. Teamwork climate is one of the domains of the safety attitudes questionnaire, is largely associated with operational outcomes. There's another scale called safety climate that's highly associated with clinical outcomes such as nosocomial infections. Here's another interesting slide that looks at how providers with different roles perceive teamwork. And no surprise, doctors think teamwork is great, because teamwork means if everybody does what I say, then the world is wonderful. And actually, our data here, this is the same 44 NICUs. Our difference that we found between doctors and nurses was higher than the comparative literature among adults. So clearly there's a disconnect here between how physicians and other caregivers perceive teamwork. And unless we're able to bridge that gap, we won't be able to deliver the safe and high quality care that we want to deliver to our patients. Okay, so here is the entire original comprehensive unit-based safety program as designed by Dr. Sexton, Dr. Pronovost. It has 7 components. You can read them. I won't read them all to you, but I would like to stress that based on the work that we have done together and Dr. Sexton has done and all the lessons learned from hundreds of implementations, what we will do is like an advanced version of this program, where initially all the programs essentially got exactly the same, all the ICUs got the same interventions, whether they needed it or not. They would get a teamwork intervention even if their teamwork was high. What we will do is we will use the survey that you just completed. We will drill down into what the specific areas for improvement are, and we will use one of the many tools, or several of the many tools that are available through CUSP to specifically target those areas that are most in need. So this is why we're trying to get a great response rate from the survey. So please, if you see coworkers that were not here during this kickoff meeting, please encourage them to fill out the survey and deliver it back to us.